All right, well, there's only one way to say it. Dogs vomit, and sometimes for good reason, sometimes not. So on behalf of pet owners, ARH surgical specialist Dr. Sarah Goldsmid asked internal medicine specialist Dr. Narelle Brown for some advice.
So Narelle, I was just going to ask you on behalf of owners who might be worried about this. So if they have their dog that morning maybe vomited once or twice, should they be worried? What should they do?
Yeah, well, really, I mean, obviously vomiting is a really common thing that dogs and cats will do, and it would depend on how they're feeling, first.
Right.
They might just vomit once and walk off and they're fine and eat their breakfast normally an hour later. So if they're otherwise bright and happy, they're not dehydrated, and so they're not losing a lot of fluid, and there's no blood in the vomit, and particularly if they suspect that they may have eaten something that they shouldn't have eaten, they got into the garbage, something like that, then it may just be fine just to not feed them for 12 hours, give them small amounts of water, and they may be fine from that. I'd certainly worry if the vomiting was persistent, if it was large volume, particularly if there's blood coming up into the vomit. You've just got a couple of little specks, it's often nothing to worry about, but if there's a lot of vomit. Also, if it's accompanied by other signs, if they're depressed, if they're off their food, if they have diarrhea, if they're losing weight, if it's a more longer-term problem. But if it's just an acute onset and it passes, that may not be anything to worry about.
What are the most common causes of vomiting?
Certainly, I think dietary indiscretion would be by far and away the most common. Dogs are eating foods that they're not supposed to eat, spicy foods.
Like my dog.
Exactly, yeah, exactly. And also, with like your dog, eating not actually food items, but, objects like, bits of clothing or things like that.
So if you had an older animal that started vomiting, would that be less likely, or would you worry about other things?
Yeah, certainly in an older animal, they're less likely to get into the garbage bin and eat stuff like that, or get into a toxin. It's more likely to be a medical problem with an older dog, so liver disease, kidney disease, that sort of thing, whereas a 2-year-old Labrador, for instance, is far more likely to have half a tennis ball sitting in his stomach.
Yeah. And what would you recommend then to the owner if they're worried?
Yeah, look, I think always if the vomiting is ongoing, they obviously should seek veterinary attention, and obviously we would palpate their stomach, we'd have check their temperature, check their hydration status, do some blood tests, see if there's any evidence of any organ dysfunction, weigh them, all that sort of stuff. Yeah, but far and away, getting dehydrated is the biggest issue with vomiting. Right. Yeah.
So if they're younger animals, say they've got a puppy or kitten that's vomiting, is that more of a risk for dehydration?
Yeah, absolutely. Those guys don't have much body weight. They're going to lose a lot more fluid proportionally to a larger animal.
So perhaps take them to the vet maybe a little quicker?
Yes, and certainly also if you had a pet that had a condition that predisposed them to dehydration, if they've got kidney disease, those animals can't compensate. They're going to dehydrate much faster than a healthy animal with healthy kidneys,
Oh, that's great. Thank you very much for that information.
No problem.
That was Dr. Sarah Goldsmid and Dr. Narelle Brown from the Animal Referral Hospital. Of course, if you ever suspect there's anything wrong with your pet, please go and see your vet ASAP.